Hello and welcome to eviCore Healthcare's educational webinar series. My name is Bill Cornelius and I'm the moderator for today's event. eviCore is a company that empowers the improvement of care by connecting patients, providers, and payers with intelligent, evidence-based solutions to enable better outcomes. If you would like to learn more about eviCore, please reach out to sales@evicore.com for more information. Throughout 2021, eviCore will host free educational webinars that include guest speakers, as well as eviCore subject matter experts to discuss today's most pressing healthcare topics. Stay tuned for our future webinars with new topics presented each month. And now it is my privilege to introduce you to our speakers today, Dr. Eric Gracious, Dr. Norm Scarborough, David Baird, and Rick Emery, as they will touch on topics such as misconceptions about utilization management and medical benefits management solutions. They will look at the individual journeys of patients who have been positively impacted by the application of MBM and UM as part of their self-insured health plan. Before we begin, just a quick reminder to please submit your questions using the question option within WebEx. This presentation will be recorded and it will be available on demand located on the Insights page at evicore.com. Take it away, Dr. Gracious.
Thanks, Bill. And thanks to everybody for attending today. I still see we still got some folks joining a little bit as we're going here. So it's going to be fun today. You know, this is a topic we think about a lot at eviCore, and we don't always get to talk to folks about it. And it's that's the topic of our self-funded employers. Most of our commercial insurance business in this country is funded by and available through your work. I mean, most of us on this call are getting our insurance through our employer today. A lot of employers choose to self-fund. And health plans have varying degrees of success in engaging their employer clients around the concept of utilization management. And so we thought it would be a really fun topic to get some of our thought leaders together here. And I'm really thrilled to be joined by Dr. Norm Scarborough, who successfully leads our very large radiology management program, as well as David Baird, who's our general manager for Musculoskeletal Program, and Rick Emery, who's our vice president in charge of strategy for our comprehensive oncology. So three of our largest segments that impact utilization and spend and care delivery for our employer clients. And we're going to have some fun today. So again, feel free to insert your questions at any time during the Q&A. We're going to try to leave some time to address those at the end, but put them in as they occur. If they fit naturally into the conversation, we may be able to address them in stream. So welcome everybody. Thanks, gentlemen, for joining. I think we're going to have fun today. And so I'll have a question to kick us off, but just a level set for the group. So let's talk about what are some of the challenges facing healthcare utilization today. And Norm is one of our physician leads. If you might want to tackle that one first, that'd be awesome.
Sure. Thanks, Eric. It's speaking as a radiologist, I've always found to be unfortunately very interesting that studies have shown that significant numbers of cases with diagnostic imaging have proven to be unhelpful, either from a diagnostic purpose or failing to help folks improve the treatment that the patients are receiving. As a result of this, these folks are being unfortunately also exposed to potentially harmful substances such as radiation and contrast. And one of the first things that I'm sure Eric remembers this as I do is that in medical school, one of the first lessons you learn is from Hippocrates, first do no harm. So in essence, if you are utilizing some procedure or exposing your patient to medications or something else, and if there's no potential significant benefit from that substance, then you really shouldn't be doing it. And so I think one of the very first things to remember about our programs is that we work every day to make sure that folks are getting the most appropriate procedures to meet their needs. And by doing so, we're improving their health, but we're also ensuring that they're not being exposed to things that they don't need to be exposed to unnecessarily. So we are improving the quality of healthcare, the safety of healthcare. And by a very happy coincidence, we're also decreasing a significant amount of unnecessary cost. Having said that, I'm sure that Rick and David will have additional views here.
Yeah, thank you, Dr. Scarborough. And certainly in the field of oncology, there are a lot of challenges that we face today in healthcare. And one of them, of course, is that gets a lot of attention is just simply the cost of care. We're seeing, roughly, typically double-digit increases in oncology costs, particularly medical oncology costs, due to the continued innovation of new drugs, new targeted therapies, immunotherapies, gene therapies, et cetera, which tend to be very expensive, many of which are also highly effective, and that is wonderful news for all of us. But it's critical that we're helping to ensure that the patients who will likely benefit from those more expensive therapies are the right ones, and that the evidence supports the use of those treatments for those patients. There is just an example, right? And we encounter these every day. Examples of cases where we're seeing providers request procedures, treatments that are really not aligned with evidence, and it comes from the incredible complexity of the evidence-based guidelines, an increasing complexity, and it comes from limited time, limited bandwidth for physicians to stay current with that complexity. And so there's a patient we saw, we reviewed a case for recently, a grandfather, a cancer survivor. Things have been going well for him, and then as part of his regular cancer surveillance, he received a test result that his oncologist interpreted to mean that his cancer had recurred, and so had requested authorization to continue, or actually restart cytotoxic chemotherapy for this patient. One of our board-certified medical oncologists reviewed the case and believed that, in fact, the patient had not had recurrent cancer, that the test did not definitively show the patient's cancer return, and discussed this with the patient's oncologist. And that oncologist then in turn brought that case to their physician-led tumor board for review. And the outcome of that tumor board was, in fact, that, yes, this patient actually, their cancer had not returned. And we helped that patient avoid what would have been really an open-ended course of cytotoxic chemotherapy that would have been very disruptive to his normal life because of the treatment-related side effects and, of course, unnecessary expenses for the patient.
Yeah, great conversation there, and you hit some really important areas. I mean, utilization really is a mix of, clinical appropriateness as well as, mindfulness around the affordability to the patient. And, we talk about things changing really quickly. Innovation's happening faster than ever before, and the doubling time for medical knowledge is around 73 days. Right now, and there are some areas that are moving even faster. Rick, oncology drugs are a big one. There was, over 150 changes to the National Comprehensive Cancer Network guidelines last year, and FDA is approving, dozens of and expanding indications for dozens of drugs a year, which is all really exciting in terms of healthcare, but it creates an information overload, and busy practicing doctors are. They're scrambling just to keep up with the clinical side, and then you layer in trying to think about how's this going to impact my patient's affordability and their ability to comply with therapy. There's just not bandwidth for that. So it's really, there's some real gaps in the system that utilization management can help to fill. So really appreciate the commentary on there. So kind of taking that conversation to the next kind of logical step. So we know some of the problems that are out there. So what do we do about that? How do we address those challenges, and how well do they work? When we're taking things to market today.
Yeah, I can take that one, Dr. Gracious. So,
okay.
There are a variety of methods for improving patient outcomes, including safety and affordability, and a key one is high quality utilization management. And I say high quality because and we know that not all utilization management is equal. High quality is transparently evidence-based, it's up to date, and it simplifies the complex. So in the field of cancer care, one can go to the National Comprehensive Cancer Network, also people refer to as the NCCN, to find evidence-based guidelines. And we often hear people say that they follow NCCN guidelines, which sounds wonderful, but we know from experience that physicians, despite their best efforts, are having difficulty, staying current with those guidelines, and will request, treatments for patients that are not evidence-based, and so that's where utilization management is so critically important. So that ability to stay current is with the guidelines is no small task. You mentioned, Eric, right? Last year there were 150 NCCN guideline updates. This year, so far, we are actually trending even more. It's more like one per business day. We're trending towards like 250 updates for 2021. So a high-quality program has to stay current with that rapid pace of change. In addition, a high-quality program makes the complex simple. And another example, the NCCN guideline for breast cancer, just breast cancer alone, is now well over 200 pages and growing. And this is where tools like clinical decision support are so important, because we can take this complexity and distill it down in a way that enables providers to navigate those guidelines in a very efficient manner. High-quality also includes the ability to help providers identify high-value pathways. So not just which ones are guideline concordant, but which ones are actually producing the most value, efficacious, clinically appropriate, and affordable. And another characteristic of high-quality is peer-to-peer discussions that involve a specialist, someone who is a subject matter expert in that particular healthcare service that they're reviewing. And that is absolutely critical. And when that doesn't happen, that's a common complaint among physicians in practice when they're not speaking to someone who is of that specialty. And then a couple other comments. One is high-quality includes a way to help connect patients to high-value service providers. So, for example, directing patients to convenient and affordable care that is close to home, that is high-quality providers and affordable. Examples at eviCore include our Smart Choice Radiology solution, as well as our oncology case management service. And then the last comment is just high-quality is constantly innovating to improve the overall value proposition. As you mentioned, right, the evolution of healthcare is just it's happening very quickly, and so a high-quality program has to innovate constantly.
Yeah, thanks, Rick. Norm, you want to expand a little bit? I think Rick hit an important area, and I think as a physician, you're really well positioned to talk through this. Just talk about the difference that we see when you have some, a specialist at the ordering physician that's engaged in this discussion and sees as a true clinical peer versus when they don't, when it's somebody who's mismatched. How does that show up in the program?
Well, that's a great point. And as a result, in our radiology program, for example, I think, in our company in general, we have about 400 physicians. They represent pretty much every stripe of both primary care physicians as well as both medical and surgical subspecialists. So in the radiology program, it's not all just, radiologists like myself. So, and we feel like that degree of a mix of those specialties is very important, because this is especially important not only with development of guidelines, but also in internally case adjudications, but it's also extremely helpful during the peer-to-peer processes when a physician who may be requesting a procedure would like to speak to someone who has a similar background. So with this degree of specialization, we are able to provide those types of peer-to-peer discussions that the rendering and treating providers find to be very helpful. This is also very, very helpful for our health plan partners because this specialization also, in essence, widens their bench of medical directors and the depth of those benches as well. So this is also an extremely helpful thing. So personally, and then on a personal level, I find it very, very comforting to know that at any moment, me, just a humble radiologist, I can pick up the phone and reach out to 1, 2, 3, or 4 more orthopedic specialists or oncology specialists. So we essentially function as a very large multi-specialty group, and it's a joy to work here. And I think most of the folks that we deal with appreciate that.
Yeah, I can validate that from my, own more remote days doing some of those calls. I can't tell you the number of times I get on the call and introduce myself, and the first question will be, "Are you an oncologist?" I'd say yes, and you would just hear the relief melt off because, all of a sudden they're speaking to a peer. They can speak professional shorthand and really kind of drive right at the heart of the matter, and also more receptive that since we understand each other, when we're providing feedback on, hey, there's some shifts in evidence, how does your patient align with that? It's a very collegial conversation. And even when there's a peer mismatch, there's, the majority of physicians out there are wonderful partners, frankly, and are perfectly willing to teach those of us that may be operating outside our depth in that particular cause, because we're saying, help me understand what part of the medicine don't I understand? So, having that physician peer that's got the right mindset, I think that's something to look for in a UM program for sure. So, and we know that health plans see value in this. They do this internally. They use vendors for this solution, and health plans use this across the board on their fully insured members. But the adoption across self-funded employers is a little bit more variable. David, can you talk through, what are some of the things we see that help to explain some of those variances?
Yeah, it's really a shame when you think about it, because especially as you go to more and more, employers, you get the large employers that are self-funded, and that the fully insured members, if you're government insured through a Medicaid or a Medicare program, chances are that you're getting the benefit of some sort of utilization management service. But a lot of those self-insured members just aren't. And as I talk to our customers around our employers and different payers around the country about that, there are a couple of reasons. One is because a payer may have had that employer for a long time and be reluctant to introduce new fees, even though those services pay for themselves. Or even going in to a new employer group, they may be focused on winning that employer group with the lowest price and not giving them the most value. And over time, we all see that, and it may even cause the payer to lose that employer group later on because of not getting the value they could give them. And it really is one of those things we've got to figure out, how do we do for others what we know is the right thing to do for ourselves? I mean, Eric, you mentioned that for the fully insured members, it's almost always included in a part of what's offered, but not so much for the self-insured. We also sometimes see the difficulty when you get into smaller populations of people. You have these high-cost things like Rick mentioned, oncology episodes. In MSK, I see spine surgery episodes or implantations of neurostimulators and things, which can be, expensive, one-time kind of cost. And when those hit in a year, and you have 2 or 3 of those hit in a year, it can throw your costs in a small population sort of out of whack. And so you do see difficulty sometimes in justifying the expense when you see those in some years and not in other years. So you do have that problem where a lot of the members of self-insured clients just simply aren't getting the benefit of this. They also typically don't have the subject matter experts to evaluate the benefit of it. When you're talking to a health plan, you've got a physician and a number of physicians in that health plan who understand the value of UM. When you're talking to an employer, talking to someone in HR, someone who's worried very much about getting the employees back to work, making their employees happy, giving them the best benefits at the best cost, they're not really aware or thinking through these solutions. So sometimes people shy away from talking to them about these solutions. But we have seen an increased amount of success in really getting these self-insured members access to these benefits. One way is frankly for health plans to lead with value rather than cost, and that's true whether no matter what you're dealing with as a customer. It's just really a better sale and a better relationship to talk about the value rather than to focus on the price tag. And where we see our partners doing that, we've had some large partners do that very successful recently and talk about the value. I mean, you are talking about from a healthcare cost, you know, 3-to-1, 4-to-1 kind of return on investment from really managing the cost. But more so, when you're talking to employers, you're seeing from an employee benefit. You're seeing the employers get access to what effectively is a free second opinion service for the doctor to make sure they're getting the right care for their condition. You see them get access to services we have, like Dr. Scarborough and his radiology program has services where we'll actually call out to the patient if their doctor scheduled them for whatever reason at like a very expensive hospital to have an image done, and let them know they may have a high-quality imaging center down the road from them or next to their work that could be 1/3 of their out-of-pocket cost to have the same radiologist read that study. And so really understanding that we're getting access to these benefits to these patients, it has been a big sales factor and a big ability to get these self-insured members access to the own benefits.
Yeah.
Rick, I know you've had some success with oncology and looking at sort of case rates and different things to really drive home the benefits. And you want to talk about that a little bit?
Yeah, thanks, David. So, yeah, a couple of other strategies that we've seen work successfully for our health plan clients with regard to their self-funded clients is, you know, an opt-in instead of an opt-out strategy has proven to be very successful. So meaning that, you know, by default, the self-funded, you know, plans are included in this comprehensive, you know, UM program. And then, you know, if there are specific clients who wish to opt out, then there, you know, there can be conversations about that, you know, we can help support. In addition, we've also seen a funding model whereby we charge on a per case basis rather than a PMPM basis be also effective, and many employers, you know, find that to be more attractive. So they're only paying for the services that they're receiving. If those services happen to be higher or lower in a particular year, it's scaled, of course, exactly to the number of cases that were actually reviewed, and instead of a PMPM model. But again, this kind of comes also from, you know, dialogue with those self-funded clients and helping health plans to support that those conversations, so they can find, you know, models that work effectively for their employer groups.
Yeah, that's great. I think we've got it's a good opportunity to insert a question that came in. So thanks to Susan Suggs for this. You know, basically she's asking, you know, that, you know, with health plans can require providers to submit a prior authorization, which, you know, employers don't have that direct access unless they're directly contracted. So asking about, you know, how can an employer group, quote, ask providers to enter a PA? So I can kick that off for us a little bit. It's, you know, I think part of it is in the pharmacy, you know, benefit space. I think that's happening today, and that happens through your retail pharmacy is usually the entry point for initiating that, so that the network happens through there. You know, on the medical benefit side, you know, usually those services are, even if they're self-funded, they're administered and, you know, through a third-party administrator, like a health plan, and the network is in place there. So in most cases, I think the employers are able to use the same infrastructure that their third-party administrators using for their fully insured benefit. But I don't know if David or Rick, if you want to go deeper on that at all, or.
I would add that what we see a lot going on. Oh, I'm sorry. Yeah, what we see a lot going on is even beyond. So yes, you're right, Eric. The employer does have the ability to set their benefits to require prior auth or to use their pay or their TPA to do that. But what we see actually a lot of progressive employers doing is going beyond that and requiring not a prior auth but a path of care. So in my world, you know, lower back pain is something that affects about 1 of 2 adults in America. And when you talk about that, really for a patient, where they go first sort of determines their path of care. If you go to a chiropractor, you're probably going to get chiropractic care. If you go to physical therapy, you can get some physical therapy. If you go to a surgeon, you'll be evaluated for surgery. If you go to your primary care physician and ask for pain meds, you may very well get pain meds. And so that's a very inefficient from a cost perspective and ineffective from an employee perspective way of getting care and delivering care. And so we do see a lot of the employers starting to mandate passive care, where if you're getting treatment for lower back, you're not going to get benefits, or at least the same benefit level, if you do end up with, say, a surgery or an expensive course of care, if you don't start with an in-network physical therapist, or start with even a pain navigator or someone to walk you through the process. So those are ways to actually go beyond prior auth to make use of these services to really get employees to the right care at the right cost.
Yeah, that's an excellent example, David. And just to build on your comment, Eric, yes, and to respond to Susan's question, yes, we have been very successful using that model, whereby the employer group is leveraging the clinical policies of the health plan, which can include a requirement for prior authorization, and as such, we are able to positively influence the care that patients are receiving, ensuring that it's the correct care, it's safe, it's appropriate, it's evidence-based, and it's affordable. And building, on David's point as well, helping to guide and navigate patients to those healthcare services, and educate them about their options for healthcare services that may be less intensive, less invasive, but ultimately, just as effective, possibly even more effective than a higher cost of intervention.
Yeah, that's great. I want to circle back on the clinical quality here for a minute, and Norm, if you want to talk a little bit for us about why it's so important that to our health plans that their self-funded employer clients have access to a broad suite of high quality, high value healthcare management solutions across a variety of conditions and specialty areas. Why is that so important?
Well, it's as I mentioned briefly earlier. I mean, it's extremely important to ensure that folks are getting the very best care that they can, and we do that by starting with our evidence-based guidelines. We've incorporated well-known, widely accepted standards and criteria from all of the applicable medical societies. For example, in radiology, we obviously have the American College of Radiology guidelines that we use, as well as other, non-radiology guidelines, such as the National Conference of Cancer Network, which we've mentioned here earlier, as well as the American Society of Colon and Rectal Surgeons. I mean, it's just a very wide variety of sources that we use as references in our guidelines. In addition to that, we are constantly perusing the peer-reviewed literature to make sure that our guidelines are as up-to-date as possible. These guidelines are updated at least twice a year. They're also updated on an ad hoc basis if new technology emerges or new uses for existing technology emerges, and we address those very, very quickly. As a matter of fact, we just updated our guidelines when the U.S. Preventative Services Task Force rolled out their new recommendations for lung cancer screening. We were able to implement that very quickly to address those issues. So that's, I think, and those guidelines are the very foundation for all of our programs, not just radiology, but all of our programs. Those types of guidelines are very important. In addition to that, as we mentioned earlier, having the appropriate types of medical directors to adjudicate these requests, provide advice, that's also very, very important. So all of this is the basis for providing the very best advice on the types of care that patients should be receiving and when they should be receiving those. That's just as important. And this provides a very high level of care for your employees, for our business's employees. It also helps with their families. All of this increases their productivity through not only just enhancing their health care, but also enhances their presenteeism, if you will. is when folks are receiving better care and their families are receiving better care, they generally tend to be, better prepared to work. And so I think that's an employer is doing themselves a large favor by using organizations such as ours.
Yeah, that's great, Norm. I think you said that very well. I think what it really boils down to at the end of the day is, like you said, it's really focusing on, we want to help employers help their employees be healthy and be present and perform well in their job. And the best way we know to do that is to make sure that they've got access to, gap fillers and supports, to help their employees better and more effectively navigate the healthcare system. So really well said. Thanks for that. So pivot for a minute, and Rick, I'm going to maybe ask you to start with Norm and Dave coming in behind. Is this pivots a little bit to another one of the questions that came in is again from Susan, great question. How do we help self-funded employers get a PA process in place? And so my corollary to that really is how do we support health plans and sales and marketing efforts when they're either helping to trying to help their self-insured groups think about this, and to the extent that we can, maybe might be worth thinking about the employers and segments too, because I think we've got some differences in when we think about smaller employers with a relatively single location, small number of employees, regional multi-sites and national clients. Their needs and challenges are a little different. So maybe if we can weave some of that into the conversation as well, that'd be great.
Yeah, absolutely. Thank you, Eric. And I'll segue a little bit, building on Norm's comments. I mean, and I think you mentioned it also, Eric, right? We know the value that these services bring and the tremendous impact, positive impact that we have for patients, and as you said, right, their families and the payers. And so, we receive all these services, right? We are the beneficiaries of, full, comprehensive, and high-quality utilization management programs and related innovative services. And, we want others to, benefit in that same way. And so we can and do support our health plan clients, their sales and marketing teams in a variety of ways with respect to messaging to their self-insured groups. So we know also that our success as a company is directly tied to the success of our health plan clients. We want our clients to be successful. And so that includes helping to ensure that their self-funded clients are receiving these high-value services that drive the best possible outcomes for their beneficiaries and the best value for themselves as payers. So as such, we are very happy and have done so for other clients to provide content from general information to program-specific summaries, PowerPoint decks, email communications, website content, et cetera, to our clients to help them with that messaging. We can also work with our clients to develop any additional content or custom content that they're looking for. And as Norm mentioned, right, we also have this tremendous depth of expertise within our organization, and so we can bring those experts, those subject matter experts, to lend support in those conversations. It could be, even supporting direct conversations with a strategic self-funded client to help them understand the benefits of this, patient-centered, comprehensive, provider-friendly approach. We can also perform training sessions for our health plans, their sales and account teams, so that they, in turn, can go out and have these, conversations with brokers and representatives from their employer group clients. So, we've done some other things like assisting with the design of employee pamphlets, brochures that help beneficiaries understand what is utilization management and why it's important for them and their family. So that's another option, as well as I think another big one is helping our clients respond to employer questionnaires or RFIs to help them win new business. So we can support in such a large variety of ways. We're here to help. Again, our success is aligned, very closely aligned, and so we want to help our clients grow and be successful and deliver the best value to their fully insured members, but also their self-funded members through their client relationships.
Thanks, Rick. David, you spend a lot of time. I mean, obviously, you lead our musculoskeletal program, and it's really a fun area, and we're doing a lot of disruptive stuff there. And as you start to think about, we're talking with our employers, and we're starting to think more episodically and longitudinally about patients. How do we help folks carry that message to the employers and the value and help in supporting their employees in that manner?
Yeah, and really where that goes is that it transitions the conversation from, mother may I about the procedure, so about which really isn't a conversation that that a lot of employers are prepared to have or think about, to something they really are prepared to have and think about. And Norm referenced this presenteeism, or are the employees happy, healthy, and at work? And so when you really start talking about condition-specific care, that's where you're getting the benefit from this, is say, hey, we're going to step alongside you as a health plan and to partner with you to deal with your patient conditions, to get them better, to keep them at work. And we can actually measure the effectiveness of that. Well, through your employee feedback, through their presence at work, through your workers' comp claims, through your overall medical costs. And we can look at, and again, the MSK space, a lot of people have pain. But what you want to do is to try to deal with that using as conservative methods as possible. You don't want people being addicted to opioids, obviously. You don't want them having an unnecessary surgery. Again, surgery has its place, and where you have a person having appropriate surgery, you want them to go to a great surgeon at the right location and get the right follow-up care they need, so they actually get the benefits of that. And so the solutions we now offer to our health plans to bring to employers really talk about that condition and how we get this patient from being in pain to being in less pain and being productive and being in control of their pain. One of the true facts is living a pain-free life for most adults probably isn't a reality. It's really, how do I moderate that pain, control that pain, and live a life that I'm happy with, that I can do the things I want to do and be full, and without letting that pain get in my way. And that's really the kind of conversation that we can enable, and we do that through utilization management, through educational materials, through this navigation we're talking about, through networks with high-quality physicians and therapists, and really helping people to understand and get access to those benefits, which help them to lead the life they want to lead. And that really speaks well to the employers, and something, frankly, they're willing to pay for.
Yeah, thanks, David. That's great. And, Rick, if I can bounce back to you for a minute, I want to focus a little bit, go a little deeper on something that I think is really personal for the employers, particularly our small group employers. And it's how do we support their people? What are the things that we can do? You mentioned care management, for example. How are the ways we can help engage, their employees directly and, educate and empower them in their own healthcare journey? If you want to go a little deeper on that, I think that would be interesting.
Oh, yeah, thank you. So, remember, I mentioned earlier in the call how high quality program goes beyond prior authorization and is constantly innovating. And so in the field of cancer care, one problem that exists in the U.S. today is that many patients are still receiving fragmented care, right? They have gaps in their needs to achieve the best possible outcome. And certainly there are some, cancer centers, providers who, very marquee names, that have very, very robust services. But, most patients aren't going to those places for their care. They're going to a community oncologist or a community hospital that has, limited resources. And so we've developed and it's actually based on something based on a program that has been, part of our organization for for a very long time now, an oncology case management service where we staff that with oncology registered nurses, people who have been in practice. We have a requirement, one of our eligibility hiring criteria is you have to have been in clinical practice at least 5 years, who know what it's like to care for patients, to treat them, to hold their hand, to comfort them, and to help patients remotely, telephonically. So this program helps identify gaps in patient needs and to help connect those patients to those sources of support, a lot of which our oncology RNs can provide through education, reassurance, helping patients better understand what type of symptoms are normal and how to manage those symptoms, but also connecting them with our health plan clients within their provider network, and even preferred providers within that network to help navigate those patients to receive all the care that they need to achieve the best outcome. And that also covers things like impacts of social determinants of health, helping patients, let's say, with transportation, or helping them with financial assistance with their co-pays, because if patients are encountering these barriers, and sometimes the provider is not maybe not knowledgeable about the barrier, or they might not be in a good position to support the patient, we're helping those patients better adhere to their treatment, which in turn is going to help them achieve better outcomes. So it's this innovation and constantly challenging ourselves. What else can we do to help patients achieve better outcomes? And when we think about this, we think about what would we want, right? And what would we want for ourselves and our loved ones? And we really want to receive comprehensive, holistic, longitudinal care services that really follow a patient throughout their entire journey and help support them. It's so critical, and we're all very, very passionate about it. So I'll mention 2 others quickly, which is we also now have an advanced care program, which helps support patients with advanced care needs, including oncology, but other illnesses. And that's a direct care delivery model in the patient's home. And then another new innovative service that we have that we're very excited about is we call it our Oncology Clinical Consult Service, where we identify patients who have very complex cancers, and we match those cases with a cancer oncology expert at a National Cancer Institute designated facility to do a remote review and make recommendations about that patient's diagnosis and treatment. And so these are services, these are the kinds of things that many patients wouldn't normally have access to, depending upon their geography, and many small health plan employers wouldn't normally have access to. But because we're able to aggregate services across a large number of members that we have the privilege of supporting, we can bring this kind of innovation right to their front door, quite literally, in the case of the advanced care program.
Yeah, no, thanks, Rick. And that piggybacks really nicely into a question I've got for Norm. And it's, you hear this theme in a high quality company, you're looking at, more holistically at the patient and being proactive and really helping to guide folks to the right care. And, it occurs to me that, an example of that is something that, radiology program cuts across a lot of conditions in a lot of areas. And, advanced imaging is certainly an important part of both diagnosis and response monitoring and surveillance across a lot of conditions. And, I think you and the teams did some really cool stuff recently around some kind of proactive leaning, utilization bundles. Like, hey, we know you're going to need some imaging. You've been diagnosed with cancer. Do you want to tell the group a little bit about that? Because I think it's kind of it's insightful in how companies can help proactively remove barriers in the system and support patients in their care journey. So if you want to talk about that a little bit.
I'd love to. It's, we are always looking, in my mind, we're always looking at enhancing the programs for the providers and their patients, your customers or employees. So in that, one of the things that we strive to do is to decrease the aggravation factor, if you will. So we're always trying to find ways to do that. And so as Rick has mentioned, a lot of these folks, when they get, they're going to have lots of procedures being done, chemotherapy, radiation therapy, things like that if they have cancers. Obviously, they also will require restaging procedures. So essentially, they're going to get, CT scans or MRIs or other PET scans, things like that, that will be done to reassess them during their treatment. And we recognize that that's done on a cadence depending on the type of cancer and the type of treatment that they're receiving. And we also know that there's a specific regimen of imaging procedures that are associated with that. So what we've done is put together bundles of these imaging procedures, and along with the numbers of times that they'll have to be performed, and those are being supplied with the request for medical oncology chemotherapy. We're able to bundle those so they're approved for the associated imaging for restaging at the same time. Here again, decreasing the aggravation factor. They're getting it all done one stop. They're getting the chemotherapy approved, and they're also getting the required imaging approved along with it. So it's a really cool idea. We're doing more and more of that sort of thing. We're automating processes and always trying to, as I said earlier, decrease the aggravation factor and enhance everybody's experience.
Yeah, thanks for going through that, Norm. I love the work the team did there, because it was sort of, in some ways, in an attempt to control utilization, it was a bit of an artificial encounter. We already had agreement in advance of what imaging was going to be ordered and what we were going to say yes to. We're just kind of putting that together and putting it out front and saying, as long as this patient continues to do well and stick with the plan, then just keep rolling. And we've got an expedited process if something goes a little sideways for the patient, which I like as well. So Susan asked another really good question I want to just take a minute and address. And she asked, in the cases where the health plan's a primary carrier, it makes sense that the health plan can opt in VA services. But what about employers who have multiple carriers, which is really common in the employer space? And what we find is most of the time that those multiple carriers split at the benefit line. So you'll have one carrier for medical benefit, another for pharmacy, maybe another for behavioral, maybe some carve-out benefits around things like gene therapy or fertility or some of those others. So it's usually at a benefit level, but certainly there are a number of medium to large employers who may have multiple health plans in place for their medical benefit services, for example, to give their employers multiple options. So I would say it's a little bit more challenging for employers in that setting, because I will tell you that the services that require prior authorization are more standard than not. So if one health plan requires prior authorization or utilization management for a particular service, likely most others will as well. And you may find that the vendors, the plans are using a similar vendor. In that case, it's really easy, because you're just saying yes to that vendor, like an eviCore or somebody similar who's doing that for all of those health plans. That's pretty easy. But also others, it may be that it's a different workflow. So you can still opt in easily, but you would have to deal with each individual carrier in today's market. But love to collaborate on opportunities to do things more differently. So thank you for the question. It's a really, really insightful one. So wow, our time has gone really quickly. I want to really just thank you, David. Thank you, Norm. Thank you, Rick, for your presence, your expertise, the work you do every day. And I want to just go around the horn once and just give you a chance to say, if there was one thought you could leave the group with, what you would want employers to know about, about the importance of utilization management and benefit management for their patients, what would it be? And I think, Norm, I'll start with you.
Sure. I think the most important thing that I'd like folks to walk away from this with is that, we are not here to say no. That's not why we're here. We're not here to somehow prevent people from getting procedures performed. Again, our mission, our only mission, is to make sure that every single patient receives the most appropriate procedures, medications, what have you, treatments to meet their diagnostic and therapeutic needs. We as healthcare professionals are dedicated to doing exactly that. And by doing that, as I mentioned earlier, we are going to improve the quality of care, improve the safety of care. We're going to make your employees feel better about just things in general when they're going through these what's quite frankly a somewhat scary experience, and we're trying to make that better for them. So and by doing so, we think we're going to help with improving their health and outcomes.
Great, thanks, Norm. David, final thoughts?
Yeah, I think Norm said it best. It really is not about no, it's about getting to the right yes. And you know, employers need these benefits because the fact of the matter is, you know, in musculoskeletal care and oncology, there's not a chance that the employees have to navigate this on themselves and get to the right yes. Honestly, they need these services to get the most out of the healthcare that's being offered them.
Great, thanks, David. Rick, final thoughts?
Yeah, similar comments. I mean, healthcare is so complex, and patients are not always even in the right, you know, mental state of mind to be able to educate themselves and navigate and make the right decisions. And you know, patients benefit tremendously from having an objective, you know, third-party expert, you know, review and you know, recommend and you know, get them to the right care that they need. And sometimes, you know, when I'm talking to people socially, right, and maybe you bring up what do you do, and et cetera, and folks will be surprised to hear me say that actually, you know, I want, you know, these services for myself and my family because of the value that it brings, right? The evidence-based nature that, as David, you said it earlier, right? It also functions like a second opinion without having to go and obtain a second opinion. And so, you know, if that changes people's view a little bit when they understand, like, oh, wait a minute, oh, do you think this is like such a good thing you want it for yourself? It's like, oh, well, geez, maybe I need to rethink this because, yeah, there's so much sort of negativity in the press, you know, today about prior authorization, largely generated, you know, by the AMA. But again, here I want to differentiate between, you know, prior authorization and high quality, comprehensive longitudinal utilization management and patient support. You know, we have evolved and continue to evolve, and our focus is really on helping patients achieve the best possible outcomes and the most affordable outcomes, because financial toxicity is a real problem in the United States. And so, you know, we are well aligned with patients' interests, and that's, I think, you know, key message that we want people to understand.
Yeah, well, thank you, Rick, and I think you all made fantastic points. And I would just sum it up by saying, look, you know, at the end of the day, for an employer, utilization management is a really critical tool. It helps you ensure that your employees are getting the highest quality and most appropriate care at the time and place that they need it, and it improves the quality of their care and fills gaps in care. At the same time, contains your costs, freeing up dollars for you to reinvest in your people in terms of expanded benefits, increased salary, increased recruitment, increased development in the company. So it's a win-win for you and your employees. So thank you, everybody. Really, again, great discussion. Really appreciate you all being here. And thanks to everybody for attending and for the great engagement and questions today.
This concludes the webinar. This webinar was recorded and will be available on demand by visiting eviCore.com. Please remember to register for our upcoming webinars. You will receive an email invitation with the opportunity to do so. If you would like to learn more about our capabilities, please reach out to sales@eviCore.com. Thank you again, Dr. Gracious, and our panel members for sharing your expert knowledge with us today. Participants, thank you all for your attendance. This concludes the webinar. Have a great day.
Thank you.